Did you know that you can have appendix cancer? Did you ever hear about appendix cancer? This is something that's rare. Please, I know, please don't think like, oh my God, one more thing to worry about. Are you kidding me? Because that's how I think. So just want to set your mind at ease and let you know that yes, this thing exists. I try not to say this is so rare because we say that kind of thing and then the person gets it. So I have a type of cutaneous lymphoma that I was diagnosed with a couple years ago that is so rare, and there's all these different types of cutaneous skin lymphoma, and the one I have is 1 to 1 million. But when you got it, and when you go to a conference and you meet hundreds of others that have come to the conference from around the world or United States, you see that it's rare, but it's really not that rare when you're staring at maybe 200 or 300 people who have it, or you start connecting online or getting into support groups and you meet all kinds of people who have this rare diagnosis. But there's hope and there is ongoing research. There are people that do nothing but specialize in appendix cancer. These researchers, these physicians are amazing, and they're giving their life's work to this specific type of cancer to help people to live with this, to manage this as a manageable disease, and to offer treatment for them. So have hope. Okay, so let's talk about what is the appendix first. So the appendix is a hollow tube that is located, I'm going to put pictures up, it's located in the right lower quadrant of the abdomen. It used to be, and it's when it's not inflamed, it's 2 to 4 inches long, or that would be what, 5 to 10 centimeters. So when a person has their appendix out, that goes to pathology, and pathology gets all kinds of tissue from our bodies, and that includes your tonsils. It includes the placenta. When you deliver a baby, or it includes lots of different things, including an appendix from an appendectomy. That's how they are able to look at cells and accidentally come across cancerous cells in the appendix, or they find that the tumor in the abdomen or colon that was also taken out, the original area that cancerous tumor came from in the abdomen or colon was from the appendix. So if the appendix has cancer in it and that has spread and gone to other areas of the body, say if it goes to the lungs or goes to the colon, the person does not have lung cancer or colon cancer. The person has appendix cancer that has metastasized to the lung or colon. So same thing with breast cancer. So if somebody has breast cancer and it has spread to the lungs, it is not an origin of lung cancer unless it's a completely separate cancer diagnosis of completely different types of cells. That can happen, unfortunately, too. Or the origin was always breast cancer and then it has metastasized to a different part of the body like the lungs. It is still considered breast cancer cells that have gone to the lungs now. There are different types of appendix cancer, and I'm going to go over those types with you, but I first wanted to share with you that I know 2 people who have had appendix cancer in their lifetime. It is something that requires constant follow-up care and continuous and rigorous doctor appointments, scans. You've just got to be really diligent about this. This is something that what you want to get to is in remission, have surgery, perhaps get everything out, have chemotherapy perhaps, or whatever the doctor orders, the oncologist and or surgeon, your team orders for you, and then look at it like a manageable disease, not a death sentence. This is something you want to manage as an unfortunate cancer in your life. But there are so many options and so many treatments that are available now for appendix cancer than there ever was years ago. The first person I wanted to tell you about is a man who was in the Washington National Guard years back, and he was a general. Now, he and his wife and children became good friends of ours because my husband was in the military, but also mainly because we wouldn't have met had our sons not gone to school together, grown up together, gone to the birthday parties together, and that sort of thing. They're a lovely family. But the interesting thing is that when we heard that he had been diagnosed with cancer, it was said He has pseudomyxoma peritonei, or PMP. He's got this mucinoid type of gelatinous cancer that has covered his abdominal cavity and his organs, and he had to have a very extensive big surgery with a lot of complications in another state than we're in, and he had this surgery done. But the origin of it was the appendix. Nobody called it appendix cancer. They called it pseudomyxoma. That's what he had, pseudomyxoma. So I feel like for years it was a really good teaching opportunity to learn about appendix cancer instead of it being pseudomyxoma. What in the world does that mean? How do I even spell it or look it up? So that is one of the types that people can get regarding the different specific types of appendix cancer. That's the kind that he had, and that's what happened. It went from the appendix to the abdominal cavity. He had all this gelatinous forming that was all cancer all around his organs and in his abdominal cavity, like I said, and they had to meticulously take that out, and I don't know if he had HIPEC or not, because were they doing HIPEC 10 and 12 years ago or more? When did that start? I'm going to look that up. I know they do HIPEC now. HIPEC is used for other types of abdominal cancers, like for women with ovarian cancer, for example, and for this type of appendix cancer that has spread. And it's done in the operating room, and it's a warm chemotherapy solution. That's it in a nutshell, that gets put inside into this abdominal area. The other person I'll tell you about in a moment, but let's go through what the different types. And I'm not going to go into each one of them. I thought you can look them up if you really want to hear more about them, but I just want you to just be aware that there are different types of appendix cancer. Okay, first one, carcinoid tumors, neuroendocrine tumors. It's the most common type of appendix cancer. Number 2, mucinous adenocarcinoma, cancer that produces the mucin type jelly substance. The behavior is that it spreads to the abdominal cavity, causing pseudomyxoma. The next one is high-grade appendiceal mucinous neoplasm, and the other one is low-grade appendiceal mucinous neoplasm. Let's talk about the treatment approaches. So like with a lot of different cancers, surgery, chemotherapy, HIPEC, radiation, can and do all appendix cancers spread? No, not all of them spread, but they can spread to other organs and other areas of the body. Let's go over the 3 main symptoms of appendix cancer. Abdominal pain that does not go away, abdominal bloating or swelling, and changes in bowel habit. But some people might not have those symptoms, and some might have things such as night sweats, fever, abdominal pain, and nausea, vomiting, or severe constipation. And that can be, but not necessarily, due to a tumor in the intestines. The average age for appendix cancer is age 40 to 50, although you'll see people in their 30s and people in their 60s and beyond. How does it start? Just like most cancers, it starts with this genetic mutation in the cells, then the abnormal cell growth, and from the abnormal cell growth come the tumors. And from the tumors, they're either going to stay in the localized area or they're going to spread. But it always begins with this genetic mutation of cells. I don't know if I mentioned one of them as goblet cell. It's a hybrid tumor with features of both adenocarcinoma and neuroendocrine tumor. Okay, it behaves more aggressively than typical carcinoid tumors, but less aggressive than the adenocarcinoma. So the reason why I was looking down, I don't know if I had said that when I was going over the types, is because the second person I wanted to tell you about is named Noah Thomas, and he is somebody in his late 30s. So Noah, I know him because his father is a retired pediatrician, and all the years that I worked peds and maternal child, I followed his father years back on YouTube as he taught us all going into the actual rooms of the patients and taught us about the different pediatric treatments, different conditions. And Noah, his son, who I'm referring to, who has appendix cancer, was his videographer and editor. So Noah has his own YouTube channel. I started following his father years back, and now I follow Noah. As I said, his father is a retired pediatrician, but his family is amazing, really wonderful people. His wife, his parents, lovely people. They are helping him and supporting him through this new diagnosis. I will link his YouTube channel below. So if you want to follow somebody who just got diagnosed with appendix cancer that has spread, I don't want to say metastasize, or I don't want to say too much because he has not seen, as of yesterday, his oncologist yet. But he did have a tumor in his intestine, and he had that removed. He had the appendix removed. He says that he is in stage 3, but said it hasn't spread, but I don't understand it quite to be where it hasn't spread, but yet you have a higher stage than what. Okay, but I'm not an oncologist. I don't know. So let's all learn together. I'm going to get back on his channel tonight as he posts nearly every day, and you can see his journey, and let's all support him. He is a wonderful man, and this is really an unfortunate disease that has come upon him, as it is for anybody who has this. Again, I want to mention there's hope. Don't give up. Go to the best medical center that specializes in this that you're able to find, that you're able to go to. There are treatment options. There are specialists who give their life's work in learning about and treating appendix cancer. There wasn't any of that years ago. You had to get on a plane and fly across the country and find the one person, which our friend, the general in the Army National Guard, had to do. Noah also has interpretation of lab results and support from his father, as you would get when you go in. You're going to get labs, you're going to get an MRI, you're going to get perhaps a PET scan. He has not gotten that. I know, though, when I was first diagnosed with cutaneous lymphoma, the first thing my oncologist ordered, labs were already done, but the first thing she ordered was a PET scan. But he has not had that done. I'm not sure why, and maybe they will do that. They will get that ordered when he goes up with his father to his oncology appointment. What were his symptoms? I'd like you to watch that yourself, but he had abdominal pain, severe abdominal pain. I believe he mentioned constipation. He had a lot of difficulty in that regard. Like I mentioned, that can be from tumors forming in the intestines, in the colon, and I believe that was one of his symptoms as well. He had no ability to be able to eat for several days. That landed him in the ER, in the hospital, and then with this diagnosis. Okay, so we talked about what the appendix is. What does it do? Well, for years, nobody thought it did anything. Now they're thinking maybe it has to do with helping with gut flora, helping with digestion, helping with the immunity. But we don't have to have it to live. So if your appendix has to come out, it has to come out. That's okay. We talked about the symptoms. We talked about the different kinds of appendix cancer, and that this is something that is a goal of, your goal is to manage it and not to give up hope, and to go to the best physicians that are out there. Surround yourself with support. I'm going to put support links down below, and different people who have experienced this and some of their stories. There's lots of lectures out there in the last few years, especially on the different treatments and different options that people have. Now, I have my mic here, but I was talking a little earlier and forgot to turn my mic on. So I had done a lot of chit-chatting before I discovered that. So I'm just going to insert here about the last part of what I had talked about. And it had to do with, if you choose to not go the traditional treatment route of, say, radiation, chemotherapy, and surgery, make sure that you know what you're getting into. If you choose to do something, say, like, ivermectin or some of these other medications that you're ordering blindly from, please do your research on that. Figure out what all of this really can do to your body. Talk to your physician about this. Ask, can I incorporate this into what you're going to do for me? So I've got a couple different things going on. Would this enhance that? Or would this make this current treatment worse? Just ask all those questions before you say no to traditional treatment for cancer, and you want to say yes to things that maybe aren't backed up by science. Just knowledge is power. Get your information, and when you go into your decision, then you will know that you've chosen whatever decision it is based on the best information out there for you. So I'll put that at the end here. Thank you to everybody, and I'll talk with you again soon. Don't lose hope. There's treatment out there. If you are someone who is not into chemotherapy and is just like, I don't even want to hear about what my options are, one thing to keep in mind is again, get knowledgeable in all of this. Listen to what the oncologist has to say for treatment for you and what's going to help you survive, and then read all the other things that you want to incorporate. Put them together if you want, or if you really are set against traditional treatment of cancer, be very careful and know exactly what these other non-traditional, non-approved methods might do to you. So, for example, my brother-in-law was recently, 3 months ago, diagnosed with stage 4 melanoma. And at stage 2, there was a treatment plan that was being discussed, but he rejected that treatment plan and decided to opt for other non-traditional, more organic, naturopathic methods. So he did the ivermectin. Remember, people, ivermectin is an antiparasitic medication. It's not going to cure cancer, but look it up yourself. Please research all of this yourself. So he chose ivermectin, a healthy lifestyle, and he really was big on the healthy mushroom powder, different things like that. But now he's in stage 4. So within no time, all of those non-traditional medications, specifically ivermectin mostly, didn't do anything. So remember, just talk to your oncologist about this if you're considering incorporating that into the treatment plan or using that only for your treatment plan. You really need to know what it will or will not do for your cancer and for your body. And I hope that this was helpful. Please share this with other people who might benefit from this information. I appreciate each and every one of you. I really appreciate my new subscribers. Thank you. I'm so happy to meet you. Please tell me where you're from. Interact with me. I'm very grateful for each and every one of you. Thank you, and I'll talk to you in our next video together.